Hi, I'm Dr. Cynthia Kew, and I am an obstetrician and gynaecologist at Mount Elizabeth Novena Hospital. Today I'm going to talk to you about painful periods. Now, many of you may have experienced painful periods, and you might be wondering whether this is normal or is there something or some disease that's affecting your gynecological organs. Let me talk to you about two types of period pain. The first is primary dysmenorrhea, which is period pain that starts soon after you initiate your first menses. So these usually start from your teenage years, and these are not due to any disease condition. The second type of period pain is called secondary dysmenorrhea. So as the term suggests, it comes on later in life, and it is due to some condition or underlying disease that affect the pelvic or reproductive organs. Now, what are the causes or conditions can contribute to secondary dysmenorrhea? The first one is endometriosis. This is a condition when the lining of the womb gets displaced outside the uterus. It makes the organs scar and stick together and causes bad period pains and sometimes difficulty getting pregnant. The second condition is adenomyosis. This is a condition quite similar to endometriosis in that the endometrium lining grows in the wrong place in the muscle wall of the womb. Every month during your menses, when the lining sheds, this causes a lot of pain, inflammation, and scarring. Pelvic inflammatory disease is an infection that starts from the vagina and spreads to the uterus, fallopian tubes, and ovaries. If left untreated, it may damage the reproductive organs. Uterine fibroids are non-cancerous tumors that grow within the uterus muscle. They often may come without symptoms, but some of them may cause menstrual pain, heavy menses, and may even affect fertility. I'm going to talk to you about some symptoms that may alert you that your period pain is abnormal. Menstrual pain that occurs during the first 2 to 3 days of the menses and easily relieved by painkillers may be usual. But if the pain is intense and severe, doesn't get relieved by painkillers, or if it affects your normal life, that something may be wrong. Pain that occurs over a longer duration, for example, if pain comes before the menses starts, or if pain continues beyond your menstrual period, is also not normal. If you have bowel movement pain, pain when passing urine, or pain when you're having sex, these symptoms suggest that you might have an underlying gynecological condition. If you have abnormal menstruation like heavier menses than usual, if you change pads every hour, if you have bleeding that lasts more than 7 days in a month, or if your cycles are irregular, you should get checked to make sure you do not have a gynecological condition. If you have difficulty conceiving, if you have been trying to have a baby for some time, this may be a symptom of some of the gynae conditions that I've discussed earlier. If you feel a pelvic mass or bloating in the abdomen, this may suggest that you may have some condition or growth in the pelvis. Do look out for these symptoms, and if at any point of time you feel worried that your period pain is not normal, you should make an early appointment to see your gynecologist for a check.